come back to those stories. Starting July 1st, 2024, access to healthcare will transition to the new Social Health Authority, otherwise known as SHA. Under this system, each household will need to contribute 2.75% of their income as a statutory deduction, with a reduced minimum monthly contribution of 300 shillings, down from the previous 500 shillings required by the National Health Insurance Fund. So, what does this mean for you? Helen Naura breaks it down on The Heartbeat tonight.
The Kenya Kwanza government has recently shifted its focus from curative to preventive health services as part of its strategy to achieve universal health coverage. This new approach emphasizes primary health care and aims to address health issues before they require more extensive medical treatment. This new healthcare model in Kenya mandates that every citizen contribute a monthly statutory deduction of 2.75% of their household income to the primary healthcare fund. This initiative aims to enhance overall health outcomes by focusing on disease prevention and promoting healthier lifestyles.
If I am earning 100 and my wife is earning 100, the household income is 200. I apply 2.75, okay? The reality is that mathematically, it is the same as charging each member 2.75, all right? But if you want us to combine, we can still combine and charge. It's the same.
Under the transition to the Social Health Insurance Fund, the minimum monthly contribution for Kenyans has been reduced from 500 Kenya shillings under the National Hospital Insurance Fund to 300 shillings under the Social Health Insurance Fund. This still raises concerns for those who are not employed and may struggle to afford even the reduced contribution.
2.75% of household income, regardless of whether it is in the formal sector or in the informal sector. The only difference is that in the formal sector, it is paid monthly via check-off in the usual manner from the employer, and for those in the informal sector, it is going to be paid as an annual premium payable in advance. Once that amount has been determined, and this is where the issue of the means testing instrument comes in, once that amount has been determined based on your income, then for those who are not able to come up with a lump sum payment as required, that's why the insurance premium financing options are going to be given, where you can have the financier paying the amount at once to the Social Health Authority so that you're covered for the whole year, and subsequently you make the payment in installments to the provider.
So what we want to do with SHA is to move towards highest standard. Because as it is now, we are providing healthcare services, but we want to ensure that at least it's of the highest standard. The other thing with the Constitution is that it gives right to emergency services. Previously, as a country, we did not have a route to execute the emergency services.
The fund is broken down into 4 cost segments, which the government says will be both individually and publicly financed.
8 billion is the stipend that we are paying to the CHP. 8 billion is the kit that we have given the CHP. Remember, this kit has some equipment for testing. The 53 billion, when a Kenyan visits a dispensary, that is level 2, or a health center, level 3, then equally, they are not expected to make a payment for the services at that level. And there you will get the basic services. You'll get testing for malaria and treatment for that malaria. And the 20 billion, let me also emphasize, the money we are talking about emergency. Ambulance services, if you get involved in an accident, that is where the money is going to come from.
The benefits package components in the new Social Health Insurance Fund include medical outpatient services, end-of-life, surgical, specialized pharmacy benefits, medical inpatient and critical care, accident and emergency, optical services, mental wellness, specialized essential diagnostic services, renal care, overseas treatment, dental health care, rehabilitative services, screening for common diseases, assistive devices, maternity and child health, oncology, and medical imaging services. The benefits package includes health education, wellness, counseling and ongoing support, which require a payment of 900 shillings per person per annum at level 2, 3 and 4. The cost of maternity, newborn and child health services at level 2 and 3 hospitals is 11,200 Kenya shillings for a normal delivery and 32,600 Kenya shillings for a cesarean section. Screening and management for precancerous lesions, as well as screening for common cancers such as breast, prostate, cervix and colon will be available from level 2 to level 6 health facilities. The fee for HPV screening will be 3,600 Kenya shillings. Prostate cancer screening is covered for males over 55 years, while colon cancer screening is covered for males over 40 years, and cervical cancer screening is only covered for women between the age of 30 to 50 years.
Cancer of the cervix tends to affect women 45 years and above. The average age of sexual debut in Kenya is 17 years. Ordinarily, it takes you 10 years for the abnormal changes caused by the human papillomavirus that causes cervical cancer for it to manifest. And from that manifestation again to overt cancer takes some time. So it means it does not make business sense to screen a 20-year-old or a 25-year-old every year for cervical cancer. One is that they could be able to get the HPV infection. Because of their high immunity, they are likely to clear it. And even if they to develop the cancer, it will come 10, 12, 15 years later. So that is the reason for age capping. Same for prostate cancer.
For renal care, the access point will be from level 3 to level 6 health facilities, and the cost of hemodialysis and hemodefiltration will be 10,650 Kenya shillings, an increase from the current 9,500 shillings. The shift from NHIF to SHIF involves transferring funds for a seamless transition, aimed at maintaining financial stability and uninterrupted health coverage. Community health promoters will assist elderly individuals with the registration to simplify the process. Instead of physical health insurance cards, individuals will receive a social insurance fund number for easier access to health services and reduced administrative burdens. Helen Aura, NTV.